So now you would be moving on with the final diagnosis, and you would be basically wanting to know what is the definitive diagnosis for this particular patient whom you're treating, because that is how you're going to plan out your management in a particular case. The laboratory tests would consist of the levels of the thyroid stimulating hormone. So this is how you're basically going to rule out whether the patient is suffering from any kind of thyroidal hormone abnormalities or not. People having hypothyroidism usually suffer from memory loss, and that is why you'd want to rule out this at this particular level. As I've already mentioned, certain endocrinal abnormalities do present with a certain degree of dementia. Vitamin deficiency, to rule out, we'd be focusing on vitamin B12 levels. You would want to have a complete blood count at your hand, and that is going to relay whether the patient has some sort of anemic conditions or not, or either the patient is suffering from an inflammatory condition of any type, either long-standing, or it can be a certain acute case of infectious condition. Now, the levels of electrolytes are also noted down in the individual. You would want to have a CT scan and MRI at your hand to note down any sort of degenerative conditions that the patient might be suffering from. You'd be focusing on the ventricular size, the cortical atrophy, if or not it is present at this stage of the disease. Some of the optional tests that you would and you can opt for are the psychometric testing techniques. For instance, you would want to rule out depression and bipolar disorders. Chest x-rays are also called for because you want to rule out any kind of a long-standing pulmonary disease in the individual. Lumbar puncture is also asked for to rule out any kind of infectious states. For instance, meningitis is also sometimes representing with the same kind of clinical picture. Liver function tests are looked for, urine toxin screening, just to have a better view that the patient's renal and hepatic functions are in normal range or not. HIV is one of the infectious states which can result in a dementia kind of a phase. You're going to order for the apolipoprotein levels as well, and we'll be moving on to rule out any kind of sexually transmitted diseases, for instance, syphilis, and you would want to have the RPR or the VDRL test. That is basically a rapid plasma reaction, or the venereal disease research laboratory test that can be ordered for, and that is going to rule out any kind of syphilis that the patient might be suffering from. We can opt for an electroencephalogram. Now, the brain waves or the EEG is going to enhance whether the patient is suffering from an underlying organic disorder of the brain, and these abnormalities can be looked for. Parathyroid functioning is also assessed, adrenal functioning, urine heavy metals, because heavy metal poisoning results in memory loss as well. Erythrocyte sedimentation rate is basically highly suggestive of any underlying infectious state. Angiograms are done to rule out any kind of cardiac pathologies. Brain biopsies are done in cases of suspicions of any kind of tumorous conditions. SPECT scans can be done using the contrast methods. Single photon emission computed tomography scanning is done, and that basically enhances which area of the brain is involved, and that is basically showing the complete set of signs and symptoms. PET scanning relating to the positron emission tomography scanning is also done, and it is going to further give you the exact idea which lobe is involved and what particular areas are involved, and this is basically making the overall management much more easier. The lab screen for antibodies is also ordered for, and basically you're going to look for any kind of autoimmune conditions, For instance, SLE is one of the condition that can arise, and it is going to result or mimic the same clinical picture as we're going to look for. So what are the different scoring systems? As I've already mentioned previously, that there are a lot of scoring systems. For instance, one is the mini mental state examination. Here you basically look for the features, how oriented the person is, by asking questions such as what is the year, what is the season, date, day of the week, month, where are you now? And this is basically showing or telling you regarding the orientation in time, space, and person. Then, for instance, you can ask for counting, and this is basically the testing for a retrograde amnesia that the patient might be suffering from. You can ask or test for a recall. For instance, you can ask that, name the things that I've told you earlier. You mention 3 things in front of the patient, and you ask the patient to recall the objects that you already mentioned, and it has a particular score as well. Repeating of the phrases, and then obviously commanding, for instance, take the paper in your right hand and fold it in half and put it on the floor. This is basically you're checking for the problem solving techniques that the patient can resort to, and how well he or she can comprehend the commands. Then drawing and copy pasting the pictures is one of the assessment techniques as well. There is a total of the total score of 30, a maximum score of 30 for the individuals. And this is again very helpful in assessing the patients. All of these questions are rephrased, and basically you ask the person and assess the person accordingly over here. So another scoring mechanism is also known as the Montreal Cognitive Assessment. Over here, you can just focus on the facts that we have visual, spatial, executive copies. For instance, copy the cube. So you ask the person, not a simple drawing, not a copy-paste drawing, but you ask the person to draw a much complicated drawing, for instance, a cube, draw the clock, and naming of the objects, for instance, checking out memory. Attention of the individual is also looked for. You ask the person to read the digits, and you can check for the language deficits when you ask the patient for the fluency or naming the maximum number of words in 1 minute that begin with a specific letter, for instance, F or G, or whichever letter you mention to the patient. Then the abstractions are also looked for instance, similarities between 2 objects. You ask the patient to give you or list down the similarities between banana and an orange. How well he or she can solve the problems and give you the arguments regarding the similarities and differences, and you're going to assess the patient accordingly. So these are all the different criterias in case of the Montreal cognitive assessments. And there, basically, you ask the person for the date, month, year in which year and day of the year as well. This basically specifies the orientation in time, space, and person for the individual. The total score over here is 30 as well, as we saw in the mini mental state examination. Then we have another technique for the neuropsychiatric examination and another scoring system known as the CogniStat. You would ask the first evaluation would be regarding the patient particulars, and you would move on with the test performances. Neurological condition, you would be testing for the visual impairment. It is a much complex scoring system, also relating to the pain, anxiety, depression, symptoms such as mania or psychosis, and you would have to rule them out. Either they are present or not. There is no in-between criteria. Secondary languages, attention deficit disorders, learning disorders, substance misuse. Then obviously this cognitive statuses are numbered accordingly as the profile, and you'd be looking and matching it towards the profile of the individual. Either the patient is suffering from an average range of dementia, mild range of dementia, moderate, or a severely impaired individual is over here, who is also suffering from the cognitive disabilities, memory loss, as well as a lack of problem-solving ability. Now, why are these scores important? Right from the start, when you score an individual and you start off with a treatment, it is even going to show you how well the patient is responding towards a particular kind of a treatment. So you would have the scoring system, and whichever you use, you would basically make it a standard for that particular patient and carry it out throughout the treatment that you're going to perform for the patient. And this is how you're going to learn what is the prognostic criteria for that particular individual. So this is how you evaluate the patients accordingly in cases of dementia.